Hello and welcome to episode number 3 of Room Study. Not late night, although here it's not late night, but yeah, we are start studying for the exam, and here we are. Uh, in episode 3, we're gonna talk about two topics, included holistic care of elderly people and effective communication with elderly people. And so we're gonna start with holistic care of elderly people. Oh, by the way, I'm at sync right now, but I'm in the quiet room, so I hope no one can listen to me, or at least I think so. Okay, let's see. What is listen to me? So basically, I'm here alone and in a quiet room so that I can talk, I can work here. Yeah, so let's get started. The meaning of holistic care is about caring for the whole persons, addressing their physical, emotional, or social, spiritual, and environmental needs. So there's five aspects: physical, emotional, or it can be understood as psychological, social, spiritual, and environmental needs. And the goal is to promote the independence, dignity, comfort, and quality of life, and not just only treat the illnesses. Okay, and we're going so because there's five aspect of holistic care, but I myself find that the psychological and the psychological, the social, and the spiritual can be combined into one as psychological. So I found that uh, I will talk mostly about physical, psychological, and environmental needs because I found three of them is the most important for holistic care. So we're gonna go first with physical care. Well, to talk about physical care and especially assessment tools, we have lots of them, included vital sign monitoring. Could vary. It can remind us, like last semester when we're talking about ABCD approach, which is airway, breathing, circulations, and something D and something E. I cannot remember, but yeah. Here we have blood pressure, heart rate, oxygen saturations, and yeah, kinds of like that. So we gotta link with the ABCD approach. Then next is mobility and functional status. We haven't known much about it because actually we haven't like known too much. Our teacher haven't been talked too much about this. We have time ups and go tests, Pareto index, which is uh not so common. Yeah, not so common. But okay, we just move it and continue with the nutritional screenings, which is familiar since we have known about it throughout the seminars. We have mini nutritional assessment MNA, which is can help us to evaluate if a patient has been malnutrition or not, and if they have enough nutrition and enough vitamins for their bodies so that they can improve their health. And the last thing is pain assessment scale, maybe numeric rating scale, and phases pain scale, which is the scale from 1 to 10. For example, like there's questions like about uh how would you rate the pain from 1 to 10, or how painful are you when smile is not at all and sad or crying is so much pain, something like that. They are kind of familiar in my opinion. So the interventions for physical aspect is medications management and reconciliations. We just need to remember the medications one, which is important. And then the next is assistant with ADLs like bathing, dressing, eating, and just only with some patients that cannot do anything at all. And if they can, so we help them to move as much as they can. For prevention strategies, for example, like environmental modifications, balanced exercise, we can talk about the environmental factors later. And then monitoring chronic diseases such as diabetes, hypertension, which is can be linked to the first assessment tool is a vital sign when we have included blood pressures and blood sugar in it. Okay, some of the measurements for this is as a nurse, we should add regular physical examinations and documentations and checking the weight, the hydrations, and elimination patterns throughout the chart, throughout some of the tools, and then recording pain levels and medication effectiveness, and also side effect, like in pharmacology. Okay, so that is the end of the physical aspect. Now we're gonna move to the next one is psychological aspect. About the psychological aspect, first we still also continue with the assessment tool. Uh, assessment tool, we have cognitive instrument tests like mini mental state examinations, MMSE, which is really familiar. We have done so much things about it. And depression and anxiety screening using GDS also really familiar. And then sleep quality assessments, not so familiar, but I think yeah, we can remember it. So we have mini mental state examination, MMSE, GDS, and sleep management. Intervention for this could be providing emotional support and counseling, encouraging participants in cognitive activities such as puzzles, readings, referrals to the mental health, and okay, and promoting sleep hygiene. Okay, I think I understand. I hope so. Um, so this psychological effects, as I said, that could be linked to the social aspect and the spiritual. And in that, we're talking about social, it means we will help the the patients that can they can join the activities like in the group community activities, make them feel less lonely or less isolated. And about the spiritual aspect, we make sure them they have that time and they have a place for their religious practice. If they're Christian, they are Buddhism, they are Muslim, and anything we should respect and give them a time and give them a place to for the practice of their religions and make sure that those practices not harmful for their health. And the process measurements here only two is monitoring mood changes and behavioral symptoms and connect with the assessment tool I told before, and then evaluating response of physi, physi, psychological interventions. Okay, sorry. Yes, only two measurements that can be used for this. So I think two of them is really they need to be done timely and regularly so that we can figure out and recognize the some of the mental disorder like anxiety or depression as soon as possible. Finally is environmental care. Assessment tools only home safety checklists and assessment of accessibility like stair, grab bars, and lightnings. And some of the home safe can be like the non-slip carpet or the Gorovke. the seat raiser for the elderly people when they sit in the toilet that they cannot go deeper, so we have the koroke. And also some of the sandals, slippers, or the lights, electricity should be make sure that safe for them when they live for the elderly people when they live in their home. Some interventions could be modifying environments, aka home, enhance safety and independence, also providing assistive device like walker, hearing aids, eyeglasses, and ensuring comfortable, supportive living arrangements like they have the sofa, the bed arranged so that they could easily go to sleep or they can go to the toilet as fast as possible when they feel like want to, and the kitchen is good enough for them or enough for them to use and something like that. Some measurements can be mentioned here, it's just only monitoring incidents of falls or injuries, which is kind of a lot when when elderly people stay at home and they without any help or monitor from the nurses. Also evaluating effectiveness of assistive device. So we as a nurse we can uh, evaluating this, and also just not like to be making it, but we can report it to the manufacturer so that they can improve the quality of the assistive device. Yeah, and that is the end of the holistic care. Thank you for listening.